The information provided in this video is for educational purposes only and is not intended as medical advice. Please consult a healthcare professional for medical diagnosis and treatment. The creator of the video, which is me, is not responsible for any actions taken based on the information provided here. Hello everyone, welcome to my channel. Today, we are diving into a critical topic in the field of medicine, particularly differentiating between the Neuroleptic Malignant Syndrome, NMS, and Serotonin Syndrome, SS. These are both serious conditions that require prompt diagnosis and treatment. Let's get started. Neuroleptic Malignant Syndrome and Serotonin Syndrome are both life-threatening conditions that occur due to adverse reactions to medications. Despite some similarities, they have distinct causes, symptoms, and treatments. They both activate the autonomic nervous system, though, which is a very important consideration. NMS is typically triggered by antipsychotic medications or the abrupt withdrawal of dopamine agonists. On the other hand, Serotonin syndrome is caused by excess serotonergic activity, often due to multiple serotonergic drugs such as SSRIs, SNRIs, MAOI inhibitors, and tricyclic antidepressants. NMS, which is Neuroleptic Malignant Syndrome, presents with mental status changes, which include confusion and agitation, severe muscle rigidity, and hyperthermia, which is high fever. It also causes autonomic dysfunction, particularly unstable blood pressure and sweating. As for serotonergic syndrome, it presents with neuromuscular hyperactivity, clonus, tremors. It also causes autonomic instability, hyperthermia, and hypertension. It also causes altered mental status such as agitation and confusion. The onset of Neuroleptic Malignant Syndrome, NMS, is gradual and develops over days to weeks, but in contrast, Serotonergic Syndrome has a very rapid onset, usually within 24 hours. Diagnosing these conditions involves a thorough clinical evaluation and understanding of the patient's medication history. The key diagnostic criteria include, for Neuroleptic Malignant Syndrome, an elevated creatinine kinase, CK levels, leukocytosis, and metabolic acidosis. For Serotonin Syndrome, you need the presence of clonus, which is like you extend it and you feel there's like a rhythmic jerking, but it's a lot of contraction based, hyperreflexia, and a history of serotonergic drug use. Treatment of Neuroleptic Malignant Syndrome includes immediate discontinuation of the offending drug, supportive care to manage the symptoms, and thirdly, medications such as dantrolene, bromocriptine, and amantadine to reduce muscle rigidity and hyperthermia. As for treatment for serotonergic syndrome, it includes discontinuation of the serotonergic agents, supportive care to stabilize the vital signs, and medications like benzodiazepines, beta blockers, and in severe cases, cyproheptadine to manage agitation and neuromuscular symptoms. Preventing these symptoms involves careful medication management and supportive care. For Neuroleptic Malignant Syndrome, we have to monitor patients on the antipsychotics closely, especially during dose changes. For Serotonin Syndrome, we have to try to avoid, as much as possible, combining various serotonergic drugs and educating the patients on the risks. Understanding the differences and similarities between Neuroleptic Malignant Syndrome and Serotonergic Syndrome is crucial for the timely diagnosis and treatment. If you found this video helpful, please like, share, and subscribe to our channel for more medical insights. Thank you for watching. Stay informed, stay safe, and always consult a healthcare professional for medical advice. See you in the next video.